And action. All right. Yeah, try not to make me laugh. All right. So, Mr. Medine here, guys, Mr. M, and we actually are going to be doing pelvis right now and hip. So we'll be doing AP pelvis, and then I'll show you guys how to do an AP unilateral hip and then a AP unilateral modified cleaves. Okay, so we'll do those 3 projections right now. We're going to go ahead and get started. So what we're going to do is we have our patient supine. They'd be wearing a gown, opening the back preferably. All right. And we want to make sure that she's straight on this table here. So right now, she looks pretty straight here. All right, I think that's good. And I always tell my students, and even if you're taking the field, and if the patient's wearing a gown, don't come down this area to see if the patient's straight. Always use the head end, okay, because they don't know what you're doing down there. You can have the right intentions and not be doing anything bad. But again, just to make the patient feel more comfortable, always go by the head end first, okay? All right, so we're starting off with the pelvis, and we're going to go ahead and turn it crosswise now. So we're going to turn the receptor crosswise here. And we're going to go to the area of her iliac crest. I'll turn this on here. All right, so I'll get this centered here just for right now. And then I'm going to put this long axis, this line here, in the mid-sagittal plane. And I'm going to go to 35 because that's going to be 14. And I'm going to go to 43 because that's 17 inches. All right, so again, I'm 35 by 43 right there. So 17 inches across, 14 inches this way here. All right, so the crest is going to look like this. It's going to come this way, and then the femur is going to be here. So I put the marker right here in the middle. Okay, so again, the anatomy of the hip is going to come out this way. So I know my marker is going to be okay there. I would put some tape on his thing just so it wouldn't move. I got to do it slowly. There we go. All right. So right now, you guys, I want to show you something here. We're at the top of the crest here, right? Here's her ASIS, and here is her greater trochanter right here. The greater trochanter is in line with the symphysis pubis. So what you want to do is you want to be midway between the ASIS, which is right here. Her crest is here. The ASIS is here, so you're about 2 inches down and about 2 inches up from the greater trochanter or the symphysis pubis. So this is your AP pelvis, but there's one important thing that sometimes some techs forget to do, and that's to turn the toes inward. So we're going to rotate the lower limbs 15 to 20 degrees. There we go. Can you touch your toes there? There you go. Stay just like that. Stay just like that. Let's move your hands out of the way. Okay, go ahead and breathe in. Let it out. And x-ray. All right. My technical factors on this young lady is going to be about 76 kVA, about 20, 25 mass. She's pretty thin. It was somebody like my size, maybe 40 or 50 mass. All right. So again, the mass is going to be on average between 25 to 32 mass on an average patient at about 76 kV to maybe 80 kV at the most. But again, here's your central ray, and this is your AP pelvis. All right, so that's pretty easy, correct? All right, go ahead and relax. Now, I'm going to go ahead and show you guys how to do a hip. So instead of doing a separate video on a hip, I'm just going to show you guys how to do the hip. So if you had to do a hip only, you guys, what you're going to do is you're going to put the central ray about right here. You're going to go ahead and column it to 10 by 12, lengthwise this way here. All right, so I'm going to go ahead and turn the receptor lengthwise. So the crest is going to be here, the hip. All right, so I know I can put my marker right over here, and it's not going to compromise the area, just like that. Okay, so now I push that in. All right, the marker is going to end up about right here. Now watch this. We're 10 by 12, so you can relax your legs. So I don't know if you guys can see this. I can see the insertion point of the muscle right here on this femur. So if we bend her knee a little bit, look at that, you guys. I'm going to use my pin here. Look where we're at. We're at the neck, the femoral neck here. So I'm not going to always bend the knee of the patient, but I just want to show you, if you just bend the knee a little bit, if you can, of course, if it's trauma, you're not going to do this, but you can always find the femoral neck from that region. All right, so in the textbook, it says that you would draw an imaginary line, right, from the ASIS to the symphysis pubis, all right, and then you would go down about 1.5 inches down, all right, to find the head, and then another 1.5 inches to find the neck. Well, we're not going to do that. I'm going to show you guys an easier way, right? I just find the mid portion between the ASIS and the symphysis pubis, and I can see the insertion point of the muscle, and I know that that's going to be my area for the hip. So for an AP unilateral hip, you're just going to rotate the limb 15, 20 degrees. All right, if you can. Of course, if it's trauma, you're not going to do that. Remember, if the foot's flopped over, right, that's indicating that they may have a fractured hip. So don't attempt this if the patient is going to have a fractured hip or potentially a fractured hip. So this is your AP unilateral hip. All right, you can relax now. Now, we're going to do the modified cleaves. So the modified cleaves, you're going to bend your knee. Okay, are you able to bend your knee? All right, can you bring it out this way a little bit? All right, so notice, all right, we're going to put that hand out of the way here. We're going to go ahead and put it right in the crease. So I'm going to use my pin here. Here's the crease. And we're going to go ahead and just turn the collimator here, just like that. So now we're going with the long axis of the femur here. All right, you guys see that? If your collimator isn't turned, you can just collimate accordingly. But this is going to be your AP frog leg of the hip, and this is a modified cleaves. This is not a lateral. This is an oblique. Her leg is abducted 45 degrees. And watch this. You see my marker? My anatomy is going to come down this way here. So I'm going to put my marker here because I know that the frame is going to be this way, and I'm not going to get this in the area. It's not going to compromise my anatomy. All right? So again, this is your modified cleaves. This is an AP oblique. This is going to be done here, right? Also known as a frog leg. All right? So these are your projections of the hip. Okay? All right? I hope this helps you. If you have any questions, let me know. Thank you. Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.